Let's talk about another rare entity in the plasma cell disorders, which is defined by the term POEMS syndrome. The term POEMS basically it's an acronym for the various types of symptoms present in this disorder. The P signifies polyneuropathy, O is for organomegaly, E is for the endocrinopathy, M basically denotes the M protein or the M spike, and the S denotes the skin changes. So this term basically is a mnemonic to remember the various types of clinical presentation in this disorder. It is also a type of a plasma cell dyscrasia. It is a very rare disorder, and it has certain classical presentations which makes it different from the other plasma cell disorders. The major clinical manifestations are the patients will have organomegaly. It can be either hepatomegaly or splenomegaly. All of these symptoms need not be present at one time. One symptom can start and the other symptom can follow. At the end of these slides, I'm going to give you a diagnostic criteria, which basically defines this disease. In these clinical manifestations, we are going to talk about the various types of presenting symptoms that can occur either at one time or at different time intervals in the progression of the disease. So the patient might have a organomegaly. It can be a hepatomegaly or splenomegaly. Lymphadenopathy is also present. These two signs and symptoms are also present in macroglobulinemia, Waldenstrom macroglobulinemia. So how do we differentiate it from that disorder? Apart from these organomegalies, these patients have certain endocrine disorders, like the endocrine presentation might be amenorrhea in a female, in a young female, or it can present as impotence in a young man. So these features, the endocrine pathologies, are specific to this POEMS syndrome, which is not generally found out in the other types of plasma cell dyscrasias, the more common ones being the multiple myeloma and the Waldenstrom macroglobulinemia. So along with the lymphadenopathy and the organomegaly, you will have varied endocrine pathologies. The endocrine pathologies can also present as gynecomastia if the patient has hyperprolactinemia. It can present as gynecomastia in a man and an amenorrhea in the female. Certain eye pathologies, because of an increased viscosity, the eye presentation can be a papilledema or hypertensive retinopathy can also be present there. The CSF pressure might be elevated, and we might find the elevated gamma globulin in the CSF as well. This can lead to the various types of neurological presentation with dizziness, headache, vertigo. The endocrine manifestation can also be in the form of thyroid disorders like a hypothyroid. Adrenal disorders can be found out, and then certain types of specific skin changes like various types of rash or certain rare disorders like the necrobiosis lipoidica, they can also be present. So it is basically a varied combination of skin pathologies, papilledema, various types of endocrine abnormalities along with the spleen, and there is an M spike. So all of these clustered together give us the acronym POEMS, which helps us to remember the clinical signs and symptoms, and also helps us to define the disease. To diagnose the patient with a POEMS syndrome, we have to meet a certain diagnostic criteria. The diagnostic criteria is simple. The patient must have polyneuropathy, so the patient might have carpal tunnel syndrome or a wrist drop. Certain type of polyneuropathies has to be present, and this is a hallmark of this disease. Along with that, we need to have a documented M spike, which signifies a monoclonal plasma cell proliferative disorder, or basically a malignancy of the plasma cells, which shows that it is a part of a plasma cell disorder. So these two has to be present. Along with that, any one of the following symptoms need to be present. Either we have a sclerotic bone lesions, which we generally are found in multiple myeloma in the form of compression fractures, or the patient might have Castleman's disease, which has certain varied presentations, or there are elevated levels of VEGF, which is the vascular endothelial growth factors. So one of these things has to be present along with a polyneuropathy and a M spike. And another symptom which needs to be present is any one of the following. Either there is an organomegaly, be it a splenomegaly or a hepatomegaly, or we have an extravascular volume overload, which is basically described by an edematous state. Edema or cirrhosis can be there. Certain types of endocrine disorders like the thyroid, the hyperprolactinemia, signifying amenorrhea. We can have certain skin changes or certain types of papilledema like the eye changes. Along with that, the thrombocytosis or polycythemia. One of these symptoms. So basically, to diagnose this syndrome confidently, we need to have four things. Polyneuropathy along with an M spike is a must. And then we need to have any one of the following symptoms present in combination with that so that we can have a diagnosis of POEM syndrome. Since it is a very rare disorder, we are not very likely to see that in our clinical wards or our examinations if you are a medical student. So you should just have a basic understanding with the term, what does the term POEMs mean, and you should understand that this is one of the presentations of the plasma cell dyscrasias. The major important topics in the plasma cell dyscrasias are the multiple myeloma, which is a major disease and the most common of all these pathologies. And we are going to talk about it in a separate lecture which is dedicated to that disorder. And in this lecture, the important disorder which you should be familiar with is the Waldenstrom macroglobulinemia, because it is the second most common type of plasma cell disorders. You should also be very much familiar with the basic genetics in the immunology leading to the development of the antibodies, which we talked about in the etiology section. Now to complete it off, let's talk about what are the treatment options we have for the POEM syndrome. Again, if it is a solitary lesion, which is very rare, solitary lesions are generally found out in the plasmacytomas. We can use radiotherapy. Otherwise, for a disorder affecting the various symptoms, we will have to do chemotherapy. For chemotherapy, we can use various types of chemotherapeutic agents like the fludarabine or the cytarabine, which we talked about in the context of the Waldenstrom macroglobulinemia. Other various types of hydrocortisones or steroid therapy is also used. And eventually, high-dose therapy with autologous stem cell transplantation, if we can find a suitable donor, this is the most curative treatment you can say, but this is very rarely performed because it has its own repercussions and it is not easy to find a perfect match for the stem cell transplantation. So we basically use chemotherapeutic agents to make the patient symptom-free. We can use various types of drugs relating to the endocrine system to counteract the thyroid. For example, if someone is hypothyroid, you can give them levothyroxine. If someone is hyperprolactinemia, you can use bromocriptine. So these are the major drugs which are used, and the management or treatment is basically symptomatic rather than curative.